Let's talk about the medication nitroglycerin, also known by its brand name of Nitrostat and NitroQuick. And if you're noticing a pattern of quickness, Nitrostat, NitroQuick, it's because nitroglycerin kicks in very fast and we need it to for the patients that we administer it to. It falls under the drug class of nitrates and vasodilators, meaning that it opens the blood vessels up nice and wide for our patients. As EMS providers, when do we administer nitroglycerin? Now, this is going to depend on your scope of practice, but the main reason we administer nitroglycerin is for non-traumatic chest pain, specifically chest pain we suspect or we know is coming from a cardiac origin. Now, like I said, these other two indications going to depend on your scope of practice, but we could administer nitroglycerin for congestive heart failure in conjunction with severe pulmonary edema and even symptomatic hypertension. So how does it actually work in the body? It works by going into the smooth vascular muscle and converting to nitric oxide. And when it does this, it induces smooth muscle relaxation and also vasodilation. Some contraindications or reasons not to give nitroglycerin are going to be use of erectile dysfunction medications like Cialis and Viagra in the last 24 to 48 hours. Also, if we have bradycardia, hypotension, or hypovolemia. As for dose and route, it just varies. If your ambulance service carries nitroglycerin tablets, the 0.4 milligrams, 400 microgram tablets, you are able to administer up to 3 tablets, depending on blood pressure and depending on the complaint of pain. It's going to be titrated to either one of those. Or you may be an ambulance service that has the IV nitroglycerin, in which case, depending on your protocol and scope, you could be administering between 5 to 100 micrograms per minute. And nitroglycerin is not recommended in the pediatric population. One of the most common side effects or adverse reactions that you can expect from your patient after getting nitroglycerin is the headache. The vasodilation often induces a pretty gnarly headache, so just be prepared for your patient to start complaining of that. Some other side effects you might see are hypotension, so the blood pressure is dropping, bradycardia. A patient could have a syncopal episode. As for drug interactions, if our patients have had erectile dysfunction medication in the last 24 to 48 hours and we administer nitroglycerin, our patients could experience a deadly drop in blood pressure, so it's very important to ask. And another drug interaction just to keep in mind is if nitroglycerin is given in conjunction with, or if a patient already has another central nervous system depressant on board, the hypotension that nitroglycerin causes could be potentiated. It could be made worse. Thank you to my pharmacy technician sister. She taught me that nitroglycerin does not have a child-proof lid because if it is prescribed to a patient and they are experiencing a heart attack or chest pain, they need to be able to open it easily and quickly in order to take their medication. Also, you'll notice in the pill bottle and in the vial, nitroglycerin is kept in a dark bottle and away from the sunlight, and that's to make sure that they don't lose their potency. Also, nitroglycerin is not to be given to somebody with a heart rate less than 50 or a systolic less than 100, sometimes 90, depending on your protocol. And one last tip is to make sure you gain IV access prior to the administration of nitroglycerin because it can make it more difficult.